Do you have clients preparing for a VBAC? Do you know what steps you can take to help them? Listen in to today's episode as I discuss what I do to prepare my clients for a VBAC.
Hello, friends. This is Lynn Schulte, and you are listening to the Birth Healing Summit podcast. We are here for meaningful conversations that will transform the way you work with pregnant and postpartum clients. Whether it is a new perspective, tool, or technique, you'll be able to implement it into your practice today. I invite you to sit back, listen with an open mind, and grab the golden nugget today's guest has to offer. Now let's get started.
Hello, everybody. Welcome to the Birth Healing Summit podcast. And today I am excited to share with you this topic of VBAC. So VBAC stands for Vaginal Birth After Cesarean. And when I have mamas that have had a previous cesarean and they want to have a vaginal birth afterwards, I really encourage them to come in and let's properly evaluate their body and let's see what's going on. And when they come in, I really like to question about the first birth. What happened? Was it a planned C-section? Was baby just in a breech position, or did you go into labor? How far did you go? How far down did baby get? Did the baby get into the pelvis? Was it hard for the doctor or surgeon to get the baby out of the pelvis when the baby was delivered? What were the details of that first birth to get a sense of what might have caused that the baby to, not be able to be born vaginally? Was the cord wrapped around the baby's neck a couple of times and it never was able to fully descend? It started decelling. What were the details around that? So we really want to get curious with what their experience was to try to put the puzzle pieces together of what might have been going on. And then I let my clients know before they come in, like, look, this is what I want to address with you. I want to take a look at your pelvis. I want to see what is going on with your pelvis. Does your pelvis have good mobility? Do we have any issues going on in that sacroiliac joint? What might the shape of their pelvis be? Really getting a sense of, do they have, what is the pubic arch? What are the distance of the ischial tuberosities and the PSISs? That can give us a sense of the opening of the pelvis. That's, it's not 100%, but we can get an idea around that. And then I really want to look at pelvic floor muscle tone. So let's take a look at coccyx, coccygeus, levator ani muscles. What's the tension in there? And then we also really want to make sure that we look at the uterine ligaments. We need to assess and release all three of the uterine ligaments, uterosacral, broad ligament, and the round ligament, and make sure that those are nice and even and balanced in there. We need to look at that lower abdominal fascia and see if there's any restriction in there. The lower abdominal fascia and the broad ligament do blend together in that area. But then most importantly, we need to, if they are pregnant, I really want to see them around, if they're not having any issues, then have them come in around that mid-30 time frame to really assess baby's position. And we need to explain to our clients the importance of baby's position for their birth. And that if baby's head is really high and it never really engaged into the pelvis, that there's restrictions there. There's issues in their body that is keeping baby from wanting to engage into that pelvis. And we can address those issues. If baby's head is heading into one hip, then there are restrictions that are creating that presentation. Baby goes where there's space. And if baby's not able to fully drop into the pelvis because it's being held up by restrictions, that's where we can really help these clients hopefully have a more successful VBAC attempt. But if someone had a C-section in their first pregnancy and they don't address any of the issues, there's a chance that the same thing might happen again. Now, there is a caveat to that, in that every baby has its own need to be born in the way that it is born. So some babies choose and need that cesarean birth. Some babies are okay coming out vaginally. And it's not ours to force a baby to turn. It's not ours to make a baby do anything because babies are smart. The babies are doing what they're doing for a reason. And we need to understand that and not force the issue. If I'm seeing a client and they are in their mid 30s, 33 to 35, 36 weeks, and the baby's head is not down, then I am going to address the entire abdominal wall from rib cage, diaphragm, posterior rib cage too. We need to address the abdominal wall, the lower abdominal fascia, the uterine ligaments, pelvic floor, and the pelvic bones. And we need to address all that and the energy flow down and out. And what is the energy like in that pelvic space? And address all that and then give the baby the option and to reposition. And our job when we have a baby that is off centered or we have a baby's head that is really high, we want to see if we can make some effective changes. So we do the body work, we do an inversion, we have baby kind of disengage from that pelvis in that inversion and then come back to normal position and reassess and see. So as a practitioner, it's your job to learn how to be able to palpate for baby's head position in the body. And if this is a new skill for you, know that I'm teaching it in my new pregnancy course, Pregnancy Pain and Beyond course. So you can check that out. It's we're launching it. The doors are opening May 5th and we'll start it May 19th. So please join me for that course. If you want to learn about how to palpate for baby's head, how to address the issues that are causing the different positions that babies are choosing in the belly, whether it's off-centered, oblique, breech. You'll learn how to work with in an inverted position with your clients so that you can release the tissues that are restricted. That inverted position is just so, it gives you deeper, it gives you more understanding of what's really going on in the tissues and more so than what you get with just your client laying on the table. So all that's going to be covered in this new course. And I'm really excited to share that information with you. Also in that course, I talk about pain. So if there is, whether you have back pain, sacroiliac joint dysfunction, symphysis pubis pain, there's kind of a list of all the things that you should address in your clients to help them with those situations. So you can check that out in that new course. Okay, so I'd love to have you join me for that. And with your clients that are really wanting a VBAC, it's really helpful. A lot of times, if they had a labored birth, a labored C-section where they tried to get baby through that pelvis, a lot of the times it's just baby coming in crooked, the asynclitic position of the baby's head. And in the new course, you learn how to look for a deflexed head, which is the most challenging position that's worse than even OP. And occiput posterior is what OP stands for. And how to address that and change that. And I feel like I was able to make a really big change in one of my clients. And it's so fun. It is so, so fun to be able to see the babies changing their position in the body. And something though I just want everybody to understand, and I talked about this with Gabrielle Brennan in her interview for this year's Birth Healing Summit. If you haven't listened to it, it was so good. That we can do all this amazing work and get baby what we feel is in the best position. The tissues are all released, they're all ready for birth, and yet they still end up having a C-section. So there are some things that are just out of our control, which is such a bummer because we love to control everything, don't we? Yet, sometimes babies need that cesarean birth. And sometimes something happens in the birth field, whether it's a provider, whether the birthing person and their doctor is not vibing together, and that's creating increased tension and distress for mom and baby. It can be little things like that. It can be big things of, major fears coming up, limiting beliefs happening, a trauma response in the body that they, may have been from something previous earlier on in their childhood or something, but it's not it's not brought into the awareness until after the experience of the birth. And so sometimes birth is a healing opportunity. Moms have these experiences to help them on a healing journey that they need to go on. And so it's not ours to stop our clients from having these experiences if that's what's really meant for them to be able to grow. And so it's, as much as we as providers love to help and want to help our clients have the smoothest birth possible, we can only do what we can do. And it does help to have really good skills and to be able to really tune into the body, to the baby, and try to adjust things as best as possible. And um, and some things are out of our control. We can do what we can do and then know it's the mama's and the baby's journey from there on out. But there's a lot we can do if our clients are choosing to have a VBAC, and we can just kind of clear things out. Now, another caveat I want to just put out there is that it's really important that we never leave any doubt in our clients' body's ability to birth. Because what I've learned over and over from talking to many midwives over the years is that the body's ability to birth is beyond our wildest dreams. The body's ability to expand, the tissues to melt, the bones to open, to allow that baby through is incredible. And so we don't want to give any doubt or leave any doubt in our clients' minds that they're not able to do this. So, but it is our job to be able to palpate the bones and make sure that the tailbone's not in the way. Is it a stop block, sticking up in the way for baby to hit? So doing some intravaginal work and checking out the pelvic floor muscles, checking out to make sure that that tailbone is not sticking straight up into the pelvis so that it's baby hits a roadblock as it's trying to come through. Those are all things that we can do. There's a lot that we can do for our pregnant clients. And I also just want to say that if you are a provider and you're wanting to work with pregnant clients, but yet you feel you either don't have the confidence or you're afraid that you might cause trauma to the mom and the baby, please just get more skills, more knowledge. But there's rarely anything that we can do that can cause harm to the baby. And I really want us to stop perpetuating this myth that we need to avoid certain spots on the body. I talk about that with Suzanne Yates in a podcast earlier, that there are no forbidden points that we should avoid because we might induce labor. It's just not possible. The hormones in the body create a cocktail that once that cocktail is mixed, then that is when baby is going to be born. And for us to think that we have that power to facilitate that is a little crazy for us to think that. So let's get rid of that thinking and know that we there's rarely anything that we can do. And the only reason I say never is because there is a never never. There could be one weird thing that happens, but I can't even name that right now. If our clients are able to have intercourse with their partners, then penetrative intercourse, then what we're doing intravaginally should have no influence on whether that baby is continues to grow or not. So, and after watching some midwives evaluate their pregnant clients to really see where baby is in their belly, what I teach in my courses and how I respectfully work with the pregnant belly is there's I can't say zero chance, but a very minimal chance that what we're going to do is going to impact that baby in any way. So I really would love for each and every one of you to have the confidence to know exactly what to do when you have pregnant clients come into your clinic. And I remember early on feeling my very first couple of pregnant clients, you're kind of like, oh, I don't want to hurt anything. I don't want to hurt the baby. What do I really do? Well, treat your pregnant clients just like you would any other client if they're dealing with any type of extremity issue or your pelvis, low back pain. I wouldn't put them in prone if they've got a really big belly there. So we got to get creative and learn other ways to work with the pregnant client. And boy, once you do, it's so fun. Once you learn how to effectively work with them, they're so fun to be able to influence the comfort level of our clients. And our work goes beyond the pain, everyone. We can address the pain, but we should really be helping our mamas with preparing their bodies for birth, preparing the baby to give the baby the best space and balance in the mom's body to find the best position for that baby to come on out. And I'm excited to share my new course with you. So if you are interested in learning more, it's a smaller course than my holistic treatment of the pregnant body course. And you can check out the website for it, and it'll be launching May 5th. So I'd love to see you in that. And it's a great stepping stone. So it's a good introductory. And there's a ton of stuff that I teach in this course that is not in my other courses. So for those of you that have taken the holistic pregnant course, please consider signing up and taking this course as well, because you will learn new skills in this course. I like to think of this newer course as working more superficially with the fascia and muscles and how to work with breech babies and really understanding the different concepts of what to do when your clients are dealing with different pain syndromes and babies positioning in the body. You'll have like the checklist of, okay, I need to do this, then this, then this, then this. And then the holistic pregnant body course dives deeper into working with the bones, manipulating the bones, mobilizing the bones and the pelvic floor muscles and the surrounding deeper structures in the body. So that's kind of how I'm differentiating the two, but they both have really good information to share with you. And if I've just learned that there's no one course that is going to teach you everything. So you need to take the little courses and take them in bite size and then apply what you've learned. And once you feel like you got that, then move on to the next one. All right. So thank you for listening in, everybody. And we will see you all on the next episode. Here's to smoother births and faster recoveries for moms. Take care. Bye-bye.
This podcast was brought to you by the Institute for Birth Healing. To discover more, visit instituteforbirthhealing.com. To claim $50 off of any online course, use coupon code podcast50 at checkout. Till next time, I'm Lynn Schulte, founder at the Institute for Birth Healing.